To suffering unimaginable loss, Terian started the foundation to help people living with mental disorders find support, break the stigma around mental health, and confront the social, environmental, and emotional factors that often go ignored. This conversation isn't just about grief, but about survival, awareness, healing, and hope. Join Garth and Natasha this Sunday from 10 a.m. on I-95.5 FM or watch live on our Facebook and YouTube live stream. Eye on Dependency. We don't just share stories, we change lives.
Not giving up just yet.
Eye on Dependency.
Not giving up just yet.
Late night, dial turns. Same two voices I return. Garth and Natasha on the line. 24 years, same lifeline. Stories in the dark, scars on second stars. From the valley to the view, they make room for you.
Eye on Dependency.
Reality radio at its best,
Where every life is a biography.
every heart gets time to rest.
Eye on Dependency.
You are more than your regrets. Hold on, breathe deep, stay with me. We're not giving up just yet.
Oh no.
Tears in the taxi,
Handshake, but you listening.
hear you struggle in a stranger's word.
Feel your own truth being heard. Calling, say your name, or just sit quiet in the rain. Hope sounds like this frequency. Love and responsibility. Eye on Dependency.
Reality radio at its best,
Where every life is a biography.
every heart gets time to rest.
Eye on Dependency.
You are more than your regrets.
Hold on, breathe deep, stay with me.
We're not giving up just yet. Oh, we're not
Giving up just yet.
from Diego to Tobago, from prison gates to home. You are not your yesterday. You don't walk this road alone. Married hearts behind the mic, keeping vigil every night. If you're shaking, stay a while.
They will meet you in your trial. Eye on Dependency.
Reality radio at its
Where
best.
every life is a biography.
Oh, every heart gets time to rest.
Eye on Dependency.
You are more than your regrets.
Hold on, breathe deep, stay with me. We're not giving up just yet.
Oh, we're not giving up just yet.
Grand rising to you, Trinidad and Tobago. Welcome once again to our Independency. Right here on 95.5 FM live on the Our Independency Facebook page and YouTube channel. Natasha, welcome.
Good morning. Thank you very much. Thanks for spending your Sunday morning with us here on Our Independency. And if you're listening on I-95, we thank you very much. As well as if you're tuned in onto our YouTube and Facebook streams, welcome. Good morning. We have a guest in studio and we are talking mental health today. May is Mental Health Awareness Month. And our guest today is no stranger to Our Independency. She's been here a couple of times before. And she is here to talk about the issues surrounding mental health awareness as well as her own struggles with mental health in her family, as well as the foundation that she has established to help grow the conversation around mental health in Trinidad and Tobago and to provide support and where it is necessary, where it is needed, where it is desperately needed. And I know, Garth, you were talking off air about some of your own struggles with mental health, given the fact of what we're dealing with our independency, and that is very key to understanding the conversation and being able to empathize with other people who are going through maybe not similar struggles, but to be able to empathize and relate to not only the situation that you're in and acknowledging what is happening in your own brain, but the important part about seeking help and where support can be found for these issues.
Yes, people of Trinidad and Tobago, this morning, I was just speaking with our guest off air, and I understand. I never thought I would have been discussing this with you all. But Herian here is Terian.
Yes.
Lost 2 family members to suicide. And I was telling her that this might sound morbid. But every time I see a post on Facebook with somebody saying rip to somebody who left us, I always, sometimes, it depends on how hard it got for the last 24 years. For the last, let's say 5-6 years, I felt that person, I felt good for that person knowing that they have to leave this torturous place. And Trinidad and Tobago, as nice as it is, as nice and beautiful as some of the people are, is an emotionally torturous place. And there are times that I, God St. Clair, thought about suicide. I never said this before on air, but I did. Many times. Knowing that I have given my life to saving lives. Knowing that I hopped a plane and I returned to Trinidad and Tobago 24 years ago to do this. So that people wouldn't walk the road I've walked. So that it will save you families from experiencing what my family experienced, especially my mother. And the people that I've met along the way, for some reason, insisted that I should not be doing that, and Natasha and I should not be doing what we were doing. I was laughed at, I was mocked, I was scorned, but the Lord knows the pain behind my smile. As a matter of fact, Trinidad and Tobago stole my smile. Because when I was an aerobic instructor, they used to call him Mr. Personality. Because I was on stage ripping the souls out of people while smiling. I loved it. But my problem is, and I was just in the terror, and I saw a picture. I would see this picture from time to time. You know, maybe you've seen it too, with 2 men, one on top, one below, with pickaxes, digging a hole, going through like a tunnel. And the one who reached just about 2 inches before he made his breakthrough just dropped the axe and turned away. I didn't want to be that guy. So I kept digging. I kept plowing. I kept going. While people laughed, mocked, and scorned. You all do understand the mental torture that I've been through. And yet still, I decided I'm not going to give up. Especially for Natasha, who took the chance to even marry me, knowing that I had a dream. So I could understand when somebody decide to end it. The thing is, we have a chance to save people. If let me tell you, if somebody wants to end it, they don't have to tell nobody anything. They go, they get what they have to they get, and do it. You just come and meet a note with them either hanging or lying on and frothing from the mouth. But if somebody tell you they're thinking about it, which means they're still reachable. And I, God Sinclair, have said that to several public officials, and that just went through one ear and came out the next. I told them how it started to affect my home. It just went out the ear and came out the next. And we were used, abused, and then spat out like plum seed. And who did it? Them going their merry way, living their life now. And I kept on begging and hoping and praying that I could be a man for my family. Is Trinidad and Tobago a place where dreams come to die? But yet, I am still here hoping that somebody would finally listen and give us the respect that we deserve. I thought about ending it all. But I was just too ashamed to take up a phone and call somebody to tell them. And I know when I leave this planet here, you're going to hear all the voices getting song bites in the news. How passionate he was, and how this he was, and how that he was. Why is it while I'm alive, I'm not hearing that and getting that embrace and being indulged rather than being embraced? I, God Sinclair, wanted to end it. If not but for Natasha especially. So this conversation we're going to have here this morning, it hits home to me. Terry Ann is in studio with us after this break. And for those of you mothers out there and your family, you know we always talk about that dysfunctional home where people end up in prison and there's only a certain demographic of people with their children going to prison. Well, we have something to show you here this morning with a 20-year-old going to prison for the rest of his life. And
or possibly facing the electric chair.
Yes,
We don't know yet.
but they saved him from a death penalty because they want to work him. He and the three others who committed the crime. And you know what the irony here? He grew up in a perfect, almost perfect home. He had everything. So those of you who have your children growing up in perfect homes and feel you have everything and they're going to prestige schools and all of these things, I want you to pay attention. Before we sign up, we're going to show you that. How that can hit home too to you without you even knowing it. And I hope you have a son home especially who you could actually ask him to give you 5 minutes of your time so he could look at this mother in court and her son in court going to jail for the rest of his life. He will never have a girlfriend again. Well, unless somebody offered to be his girlfriend in prison. He will never celebrate another birthday. He will never know what it is to kiss another woman for the rest of his life.
At 20 years old.
At the age of 20. So, that I rambled enough. Let's take a quick break, and when we return, Terry Ann is right here with us. She lost her son, and say morning, darling.
Hello, good morning. Yes, so I lost my son and my daughter's father to suicide. And the most recent suicide was 3 weeks ago.
3 weeks ago.
3 weeks ago.
So we'll get into that
Let's go,
and
Sandra.
also talk to Terry Ann about her foundation and some of the other information that she has to share about mental health awareness.
Yeah, and you know, I just want to let people know, somebody messaged me, I just want to let people know, those who laughing and mocking at my pain, the old people are saying, what don't meet you and pass you. Laugh, but remember, laugh and cry lives in the same house. Let's go to a break. We'll be back.
Why do all schizophrenic patients, not all but most of them, have the same delusions?
Hey, I'm Dr. Joel, the Medical Mythbuster, and this is a great question, so I actually want to answer it. Why is it that people with schizophrenia think that they're all God or that the government's after them? The answer is actually pretty fascinating, and it has to do with what's happening in the brain. A chemical called dopamine, and one of its jobs is to tag things as important, like, hey, look at this, let's pay attention to it. In schizophrenia, that system breaks, and your brain starts tagging everything as important. If a stranger glances at you, that's important. If a car drives by twice, that's important. If there's a vague news report, that's important. Your brain is screaming that something big is going on, but you don't know what. So you do what any human would do. You try and find a reason why. This is where it gets interesting, because when you need to find out why the whole world is focused on you, you reach for the biggest explanations that humans have. Someone powerful must be watching me. That's the government. I must be someone powerful. That's being God or being called the chosen one. Or there are hidden forces at work. That's conspiracies. These aren't random. These are things that all humans care about. Safety, significance, control, and meaning. In fact, a massive study looked at over 20,000 patients in 30 countries. The themes were identical everywhere. Persecution was number one in every single culture. Not that people with schizophrenia are making up a story or that there's specific frequencies that are being put into their brain. It's that the same brain malfunction is hitting the same deep human concerns. That's what makes it a medical condition. Different people, same wiring, same concerns. To me, whenever I see a patient with schizophrenia, it's a reminder that these patients aren't having delusions that are random, it's that they're heartbreakingly human. The next time someone asks that question, now you know that it's not a mystery, and that really what it is it's neuroscience meeting the human connection.
Have you ever heard of borderline personality disorder?
It's a mental disorder. It's called borderline personality disorder.
It is a psychiatric condition, sort of similar to how narcissistic personality disorder is a psychiatric condition, all belonging to cluster B personalities. Borderline personality disorder is mainly characterized by intense emotions, an altered self-image, and very poor interpersonal relationships. So let's dive into just some of its features. They often experience intense mood swings where they can move from being happy to sad within minutes. And colloquially, people are going to call these people bipolar because they don't truly understand what bipolar is. And their moods swing so dramatically and with something very simple that wouldn't usually anger a typically normal person. They have an intense fear of abandonment, and that might make them appear very clingy at times or very angry at times for anything that would make them think that someone would leave them. They engage in intensely impulsive behavior, gambling, sex addiction, alcohol, binge eating. These people, they will tend to make a lot of drastic permanent decisions based on a very temporary emotion. Just imagine not responding to a text quick enough. That sense of abandonment will be felt, then brings on intense emotions that can bring out rage where they will do something very impulsive. Understanding this is very important because, as I said, it is a psychiatric condition, and those with it will first need to know they have it, and then they will require a lot of support in order to go about just having a normal life.
You're listening to Eye on Dependency. We don't just share stories, we change lives.
Thank you for staying with us. This is Eye on Dependency, and we are talking mental health this morning. May is Mental Health Awareness Month, and our guest this morning is Miss Terian Gunpat. No stranger to independency, of course. But let's get right into it because you know how time flies on this program. So she mentioned earlier that her son and her daughter's father both passed to suicide. Well, let's start with Brandon. I know you've told his story here before, but what people may not know is that he was diagnosed with schizophrenia, and you heard that clip. You may have heard that clip that we played during the break. He was diagnosed with schizophrenia. So tell us a bit about what that journey was like for your family and what you wish more people would know about living with and supporting somebody with schizophrenia.
Okay, so Brandon was diagnosed as early as 15 years old, right? The effects that it had on us as a family First of all, we were in denial. I think when you have little to no knowledge about mental health issues, the first thing you're going to jump to is, nah, that can't be happening to my son. My son? No, 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 not my bright, compassionate child. That, that isn't happening. But the longer you stay to take your child or your relative to see a doctor, is it more that the illness will progress. And it doesn't mean that if someone is displaying certain signs means that they're going to be diagnosed with a serious mental illness like schizophrenia. But what happens is that if you go to the doctor could then assess the person and, then give a diagnosis. It could be something like just depression. And yes, depression is also a mental disorder.
Yes.
But not all cases they need to get medication, and I think that's another fear of people wondering, oh gosh, I'm going to be on some meds and I'm going to have me spaced out. But as a family, we first of all, it was something that we knew nothing about, and it was scary to everyone.
So for someone listening, can you take us through the journey of when everybody paid attention to what was happening to Brandon? Let's start with his school. Did he have friends? How did it, so that people can identify if they're seeing that in their child right now?
All right, well, he first came to me and told me that he is seeing things and hearing things that he don't believe that is there.
And he wasn't using any drugs or anything?
No, he was not on any drugs. He didn't drink any alcohol or anything like that. That was the first thing that was happening.
Right.
And he came to me directly and told me. But what made it real to us is the incident that happened in school where someone called. It was the dean. She called my phone and she called his father's phone and told us that we need to come and pick up Brandon right away. Of course, they didn't want to discuss what was happening on the phone. So when we got there, they told us that Brandon wanted to jump off the roof because he said that he could fly. And the child's eyes were wild. I don't know if you've ever met anyone or you know someone that when you look at them, you can see that they're not really seeing you. There's a look in their eyes that looks, according to some people, look dead.
Yes.
They're
and
not really present.
No, they're not present.
Yes.
And that was how he was looking. And at that point is when me as a mother recognized, no, this is real. This is really happening. And at that point is when he went to the hospital for the first time. Now, of course, we didn't send him to the hospital right away. We went to the doctor first. And, from there, it led to a whole lot of other things, different medications that we tried. He was institutionalized. All of that happened within a very short space of time because, of course, we had little knowledge.
And when you went to his primary care physician, a GP, and then that would have escalated to psychiatric care, how did the rest of the family react to that? I mean, as I assume at that point, when he got the institution, he was then diagnosed. So what was the response to the diagnosis itself? Understanding in the context of not being aware that this is a serious illness and not some, what to call it?
It's
a
not
demon
just
somebody take
I want
over.
to get into that, and I don't want to be controversial, but I grew up in church. I was born, if you want to call it, in church.
Right.
Most of my family members are pastors, if not in Trinidad, in other countries. And I will tell you that everybody consensus was it was a demon, right? Even the way that it happened in school, he was going to Trinity in Mocha. And even when it happened in school, the whole thing was centered around a game they were playing called Charlie Charlie, similar to a Ouija board game, right? I myself tell myself, right? I say, well, it had to be some demon come on this child and causing this child to have these mental issues, hallucinating, talking to himself, answering himself, you're talking to him, he there but he not there. So he taken, it'll have a few seconds of delay before he answers. So immediately everybody telling you, or you're telling yourself, is a demon.
He's possessed.
But it's only until we went to one psychiatrist that was very close to where we were living. His name is Iqbal Ghani. When we went to Dr. Ghani heard the name Gunpat, and unfortunately, not that we are trying to stigmatize the family or anything like that, unfortunately, just like in a family that has diabetes as a disease running in the family, that family unfortunately had schizophrenia running in their family genetic line.
Right.
So we were in shock, right? Just as, as I say, we were unaware. And it was only at that point we recognized this is real.
Wow.
So schizophrenia could be genetic,
Yes.
right?
Yes.
You could, I know, I sure, because I've heard it myself. I am sure in some family member, you will hear somebody saying your uncle, your grandfather, brother from long time, somebody hit him in the head with a stick and he went mad. That's how they used to explain things long time for when somebody have mental issues.
Yeah.
And it doesn't mean
Or
that the
somebody
person
put a
get,
light on you.
yeah, and it doesn't mean that somebody mash something somebody put there for you, or somebody hit you in your head with a stick. It means that the person have mental health issues.
Correct.
Just as a physical issue, mental health issues stems from something occurring in the person's brain. That is physical. We may not be able to see it because it's inside. I don't think anybody could see God forbid, hypertension. I can't look at you and say, your blood, you have hypertension. Or
diabetes.
or Natasha, I could watch you and say you have diabetes. It doesn't work like that.
Correct.
Similarly to mental health issues, this is happening in somebody's brain where the signals and the chemicals in your brain not functioning, it not going from one to the next. And it's as simple thing as that. And I think people try to create a spiritual aspect to mental health issues and make it sound like if somebody put a curse on this child or somebody put a curse on your family. I am not saying that spiritual things do not exist. I don't want people to come at me. I'm not saying that it does not exist, but the way that I grew up, I could tell you that in church they just call all illness a spirit of infirmity, right? So why this can't be a spirit of infirmity too? A mental health issue.
Yeah.
That's also an illness, so that could be a spirit of infirmity. And the same way that if you get diagnosed with something. In fact, no, let me give a physical example. If your foot break or your hand break, would you go to the pastor and say, let pray for me, I want this bone to heal? Or would you please go to the hospital and get a cast? And at the same time, your parents or your grandparents who are very religious or spiritual will still pray for you, God, heal this bone quickly so that we could take this cast off and this child could get back to school. It's the same thing with a mental illness. You take your medication if you're prescribed a medication, or you go to therapy, and guess what? Mommy and daddy will still pray for you.
If you're just joining us, you're listening to Independency, and we are speaking with Terry Ann this morning, who lost her son to suicide, and another family member just 3 weeks ago to suicide again. And believe me, this program hitting home this morning, and I'm trying not to break down. So, if you could, as much as possible, keep me off camera, I'd be happy this morning, because I have an interview coming up that I have be interviewed, and I don't want to go along the place and go to that interview looking all messed up. But so yes, coming back to your son, how did it progress from there? Because you had to go to visit school many times, right, about him. And did you feel helpless? Did you feel like eventually you were going to lose your son?
Honestly, I was in denial, and I never thought that it would reach to me losing him. I never thought that, and I will say on air that he did attempt a few times and was unsuccessful.
Oh.
And even with that, I still did not think that it would reach to that. Because what he would do is, let's say he want to attempt, he would call me or my brother, my youngest brother, who he was very close to, and he would say he ain't feeling good, he feeling suicidal. He will actually use those words. And I would, if I'm not in work or whatever, I would tell him, pack up. Are you in work? I'll ask him, you in work, you home, whatever. I will go and pick him up, right? And I would take him straight to Mount Hope. Mount Hope has a psychiatric unit, and we would take him there. And if need be, this is not a joke, Brandon used to ask sometimes to go to St. Anne's, because he knew that in St. Anne's, according to him, he actually come out feeling better when he was in St. Anne's as opposed to Mount Hope, right? But I will tell you that it did progress, because just like, you know, when you're on a certain pain medication, or let's say you have migraines and you start to take Aleve for this migraine, after a while the Aleve will start to become so, your body gets so used to it that it doesn't work anymore. It happens.
So you have to up the dosage.
Yes.
To get the same thing with drug use.
The same thing with any type
with
of
cocaine, marijuana, alcohol.
Yeah, because you don't have to try to get the same high you was getting. So it's the same thing with mental health issues. You might be on a certain drug, let's call it haloperidol, which is Haldol, right? You might be on that for some months, but then after a while, your body becomes so used to it that it stopped working for you. So now the doctors have to now try to get a different medication prescribed. And it does not mean that the medication that they get gonna work. It's a trial. Just as any other sickness, it's a trial.
And because I suppose the illness itself is specific to the individual, so you really have to try different kinds of medications before you find one that works
for
over
that
time
person.
For that person. And the additional concern of Brandon being a teenager and not an adult. There are different, treatments. As with addiction as well, there's a different level of treatment that you apply to someone based on their age.
Definitely.
Yes. So at what age? So you said he tried at least. Did he get ill from trying, or it just went through his system? Or what did he use? A substance? Because I guess he didn't try to use.
It was not substance, but what I would say is that at each attempt, what was happening, and this is what I want other people to know who's dealing with a mental health patient, you have to make sure they take the medication. Each time Brandon felt that way, it was because he himself stopped taking the meds. And I don't know if you would have known about this before, but when a doctor prescribes medication for a mental health patient in particular, they have to wean them off of that particular medication before they stop it. It isn't a stop cold turkey. And it's for this reason. And you have to, as a person, has to read up on the medication to see the side effects of it as well, because there are certain medications they treat for depression that the side effect is suicidal thoughts.
Correct.
So you have to do your own research. Even if a doctor prescribed lithium to you, which they did for Brandon, the side effects of that was suicidal thoughts, and while on lithium, Brandon committed suicide.
At what age?
He was 21.
Let's go to a break, and when we return, you will hear how you found him. You found him?
No, his uncle did.
You will hear about that. You're listening to Our Independency. This one hitting home this morning. I'm not fooling. But I'm happy we're having this discussion, because those of you who my paths cross, or my journey, we cross paths, some of you listening to this broadcast this morning could either identify, or some of you knew you could have helped and you refused to. That I'm be talking like this morning. But I felt that this was the forum to do it, because I felt sick every time. And Natasha is my witness. I cannot go to bed. I try to go to bed before 12. You know why? I try hard, because I want the day to drag on so that I could find an answer before I touch down. So sometimes I'm looking at the TV and but the TV looking at me,
looking at you.
or trying to listen to something, and I am amazed how I could retain a calypso to go on stage and sing, because it's something that took me away from the pain that I was suffering. But what I want you all to understand, that emotional pain is something that has no ointment. The only ointment for emotional pain is drugs and alcohol. So this is why we try to numb it with these substances. But I insisted I will go cold turkey and not try to use these substances to numb my pain. But trust me, every time I left an office in this country here, most of the time I went back home in pain. And this pain got so severe at one time, when I see Natasha go off to work, I look at her and I say, you know, you mightn't see me when you come back home. Let's go to a break now. Let's go to a break.
I'm just coming on here to let all you know that sometimes you really just need to take the medication. Now, when it comes to mental health, I know that's something that we still wrapping we head around, because things like anxiety, depression, bipolar disorder, all them kind of things was really seen as Western ailments and things that all them foreigners used to get. In Trinidad, you just had no behavior. Or one of our favorites, your ass just too happy. Meanwhile, you so depressed you could jump off a building. And especially as you've been seeing an uptick in suicides lately, I really feel like this is important to talk about. For me personally, during 2020 and 2024, I was going through one of the worst times of my life mentally. I mean, like, I had a point in time where I was crying every single day, or at least 4 times a week. I had suicidal ideations. It had times where I was crying, not even knowing really why I was crying. It was just a real heavy dark time. And it was only around 2023 when I finally went and get diagnosed with generalized anxiety disorder. And it took me a while to get it, because I think at one point I was just like, I don't know what's wrong with me, but I didn't think it was actually something that was serious as mental health. So when my psychiatrist recommended that I take medicine, I was like, dog, now all you're really trying to put me in the madhouse. All you're trying to put the grippy socks on. But I'm here to let all you know that sometimes you need to take the medicine. If you have high blood pressure or high cholesterol or other things, you have to take medicine for that too, eh? So why you wouldn't take medicine for something that is a sickness in your mind? They had prescribed me Lexapro and hydroxyzine. Lexapro is something that people is used for depression and things, but it also does work for anxiety. And I was also taking hydroxyzine, which is more of like a sleepy drug. That's more for like, hey, if you're crashing out, take this and knock out. When it came to Lexapro, it really helped. When I tell you, it was like night and day. I went from crying every day to maybe crying once a month. And it is true what they say, it's really feel like it's mute all your feelings, but I think for me I needed that, because I always had like a hyper response to everything, and I just needed something I was able to calm my mind so I could actually think through stuff and work through my emotional regulation. So all I have to say is take care of yourself, talk to the people that you need to talk to for support, but also if you have to be on medication, don't feel no kind of way or anything, because you need it.
Yeah, I really need it.
Right now I'm no longer on medication, but I definitely recommend it to anybody who feels like they're at that brink and they need that help.
Hello. Hi, this is Patricia Kent from HMP London. Can I speak to Miss Sheila, please? This is Miss Sheila. Hi, I've got an important call for you. Please hold the line.
Mommy, it's Sherry.
Oh, God, Sherry, we looking for you all the time. 3 weeks now. Where you going?
Mommy, I'm calling to tell you I get locked up. I had drugs in my luggage and I'm in England right now. In jail.
Oh, God, Sherry, what? What you do? How you reach there? Oh, God, how we gonna go?
Oh, God, Mommy, don't cry, don't cry, don't cry. It'll be all right. Sorry, I'm sorry.
Eye on Dependency. Reality radio at its best every Sunday on I-95.5 FM. Don't miss it.
You're listening to Eye on Dependency. We don't just share stories, we change lives.
Thank you for staying with us. This is Eye on Dependency. What is turning out to be a very sensitive subject this morning, mental health. As you know, this can affect anyone, and fortunately or unfortunately, Garth is feeling the effects of it at this time. But to continue our conversation, and just based on what that video that just played about medication, I can relate to that. I was also diagnosed with anxiety and depression, and refused the medication when it was offered to me because I just generally don't like to be in a medicated state. So I felt, this is something that I could handle without the medication. I will try my best and do everything else other than that, because I didn't want to have to depend on the medication. Now, this is a decision that I made for myself, but I want to believe that for more serious illnesses or chronic mental disorders, medication is necessary, especially for something like schizophrenia or bipolar disorder. You agree?
Definitely. Definitely. Some mental health conditions, even with severe depression, medication is required.
Yes.
Just to be able to regulate what's happening in the person's brain.
Yep.
Basically, that's really, it's a regulation. Just as I would have mentioned, if you have diabetes or you have hypertension, you need medication to regulate.
I think maybe some of the gaps include how physicians would explain to a patient what the drug is actually doing, because when you take a medication for your heart or whatever, they would explain that this dilutes your blood, or it expands your blood vessels, or you can understand what the medication is actually doing in your body. But I think it may be more difficult to explain how these medications actually treat a mental disorder. Have you done any kind of work or know anything about that? How exactly the medications work?
Well, for Brandon with schizophrenia, he had to take antipsychotics. That was to reduce, it may not eliminate completely, the auditory and visual hallucinations and the delusions. With schizophrenics, they live in an altered state of reality. So, for example, this is what really happened. A day I went to see him, he was in Mount Hope, and he told me when I'm coming back the next day, he wants me to bring foil. So I said, foil for what? He said he wanted to make a hat with the foil because planes that passing overhead was reading his brain waves and seeing his thoughts. So he lived in a state of thinking, this is really what's happening, and he really believed it. And what I think people need to understand and try to have patience is that they are living in that reality.
Yep.
That is their reality. It would not be ours because we're not experiencing it. But we have to treat them as though what they are saying is valid because it's valid to them.
Yes.
And you don't want them to feel like if everyone is against them, because there's another thing that happens. They start to feel like they are alone, nobody understands, and everybody is against them. And all they want to do is shove medication down their throat so that they will become a different person. That was one of the things he used to say too. Like he used to say, like, this is making him feel like not himself because he was like a zombie when he's on the meds. But then you have to think about, it's like you're between a rock and a hard place. Do I leave him to have these delusions, and then eventually, and he did hear this voice, a voice told him to step in front of a maxi while it's driving. So you have to think about it. It's either you want them to be in a state of being like a zombie for a little bit, or you risk them doing something crazy. And I will tell you, this is based on my own thoughts and going into the schizophrenic mind. You know that I believe that a number of serial killers were schizophrenics, because I cannot imagine somebody doing something like that and just living a normal life on the outside. It has to be something going on in here that causing them to make decisions like that and think it's okay.
Yeah.
So, as I said, it's a risk. So it's either you take the risk of leaving them untreated and letting the disease or the condition progress to a state where it is unmanageable, or you just, explain to them, listen, I know you're going to not feel like yourself for a little while, but it's only because we are trying to manage the condition.
Yeah. And see that you do not harm yourself or others in the process.
Yes.
If you're just joining us, you're listening to Independency, and we are speaking with Terry Ann, and Terry Ann, she has a foundation. She'll tell you all about it in a while. But she lost her son to suicide, and then a close relative just 3 weeks ago to suicide. Now, we were going to get into who found him when he and what did he use. If you care to tell us about that part, but who found him?
What was happening is that his bedroom door was locked. So I unfortunately was on quarantine at the time because it was in the COVID time, and this was the Delta strain. So that was the one that had a lot of deaths. So he was not. I didn't allow him to come home because I didn't want him to get COVID, right? So he was by his dad, which is where he lived most of the time. And that morning his door was locked, which is not like him.
Unusual.
And at around 10 a.m., I guess they realized he didn't know Brandon is a boy, he like he belly. He didn't come outside, he didn't say, well, he want food or anything like that. So it was unusual. But that day in particular, they had a number of family members at the house. So the house was quite busy. So it's only when they looked at the time and realized he didn't come outside yet, they realized that something was wrong.
Right.
So they went to knock on the door and all that. He didn't answer. And they have a wraparound veranda. So somebody went around and saw him. They just saw his feet, right? So his uncle broke down the door and found him. And then his dad called me when I was home, and I break. At that time they tell you could get in trouble if you break quarantine. I didn't care at that point. I broke the quarantine and went down.
Yeah, I mean, come on, you're his mother.
Yeah. That I couldn't. It was unbelievable. It was unbelievable.
Oh, sorry. Yes, come on, you're his mother. That's expected for you to do, And so you lost your son at 21. How long did it take you to recover from that? And did you blame yourself?
I blame myself every single day. Every single day up to this point. Brandon would have died the 27th of September 2020, and I still live with that. Even though a lot of people would, even counselors, everybody would say, that isn't your fault, he was ill. As a parent, especially a mother, you would go over in your head over and over what you should have done, what you should not have done. Maybe I should have known he wasn't feeling well. Maybe I should have known that the night when he messaged and the way he was speaking, I should have picked up on something. But I got so used to him being so open, telling me when he wasn't feeling well, that I took it for granted that maybe he feeling okay. And even though I physically got a feeling like I was in labor during the night, and I was in pain, and I started to cold sweat and thing, I looked at the time and I went on WhatsApp and I saw his last seen was 8:28 p.m. And I know when he takes his medication, he's kind of knocked out. So I say, instead of me waking him up to make sure he okay, maybe I should just leave him, let him rest, and in the morning I'll tell him what happened, and I say maybe COVID now coming on me, like that particular symptom. Not knowing that that was the time the child was losing his life. When people tell you a mother has a genuine connection that is out of the natural realm to their child, that particular instance, I knew it was real.
I can feel this, Terry, and you have to. No mother should be burying a child. It shouldn't happen. And of course, your family came together, or was there any blame game going on within the circles?
I would say from on my family's end, no one blamed anyone.
Right.
It was more like it was a extremely sad time, and I guess nobody had the words. The only thing my grandfather told me is that it's all our fault, as in everyone, because we should have been paying more attention to him. And I could tell you from my perspective, because I was so paranoid, if you want to call it, I would have make sure that he didn't lock his door. That's just me personally, but I do not blame anyone for what happened. Right? It's nobody's fault. He made the decision to do this under whatever mental state he was in at the time. And there's no one to blame for something like that. You can't really assign blame to anybody for something like that, because many people who do things like that, it's their own decision based on what they would have been experiencing that they just couldn't handle anymore.
Yes.
Right? So there's no one to blame. A child in school could be bullied, and you could go blame all the bullies in the school and say, well, it's because of you my child end up committing suicide. And while, yes, you could assign some blame to them for causing the child distress, they didn't make the person do that.
But there are cases here and around the world where children who were bullied, especially online, decided that they're going to end it. You know, they couldn't take it.
Yeah.
And you could understand why, right? Going to school, you want to fit in, you want to be a part of the boys or the girls, and you're constantly being bullied. So every time you come on the school bus or car drops you off to go into that school, you get depressed one time because you know you're going to see somebody on your way in, or you're hoping you don't see anybody before you reach the class. That kind of thing, that kind of fear.
It's a fear.
You know? And so I could understand, I'm not condoning it, supporting it, but I could understand somebody wanting to end that type of pain.
Of course.
You know, and so there are children who took their lives because of bullying in school, and this is why bullying in school has to be on the front burner all the time, because you're affecting a child's growth and mental health.
It should be no tolerance, not lower, no.
Yeah.
Zero tolerance. It should not even be partly understandable. I don't think that any school in this country or in the world should condone any type of bullying, whether cyberbullying or otherwise, because it affects a person's mental health for life.
Yep.
I actually know someone from school. We leave school since 1996, and this person is still experiencing the lasting effects of being bullied from since way back when.
Yep, absolutely. And that the recent revelations about the principal at Holy Name Convent is evidence of that. And as an alum of Holy Name Convent, I can attest to that, because in a recent visit to the school for work, I had a panic attack on my way there while I was there. Because
Going back
of
to that place of
Yes.
it took me right back, and since I left in 1992, I hadn't set foot back on that school compound. So 32 years later, I am going there for a work-related, simple thing, a career day, and driving there, my heart racing, a cold sweating, and it took me a while to even, when I got into the school and I parked and realized I have to talk to somebody to find out where the class is. And it was a mess. So you're right, God, these things do stay with you,
of course,
for life.
Of course,
and I just want to offer my commiserations with those women and girls who spoke up. And that leads me to the next question about...
Before you do that too, Natasha, keep the question, right?
Yeah.
I want to say to the children, to your parents out there, because our mother spoke to me about this. Everybody did not pick the gender they want to be.
Correct.
Nobody did that.
Correct.
So if you have a friend or a child going to school who is gay, you have no right to disrespect that child and bully that child. That is not your right. Leave, give peace a chance, and let everybody grow how they feel comfortable. Because there are people, and this one person I know for sure, whose son ended up using cocaine because he's gay and being tortured for that.
Yep.
Who gives anybody the right to decide who be what? This is my point. And so I understand where this is coming from. Your question, Natasha?
My question was just directed at the persons who go through these experiences of being bullied or abused, and it is causing them a struggle with their mental health. It is important to speak up and to tell somebody about it, because often cannot manage this on your own without support, without help, and that is the hardest part, I think.
Talk
for
to
most
who,
people.
Natasha? Talk to who? Let's go
to
there
who?
now. You see, I just wrote it down here. Talk to someone in question
Yes.
mark, right?
Yes.
Terry-Ann, if you're just joining us, folks, you're listening to Independency, and we are speaking with Terry-Ann Gampat, and she will tell you all about her foundation because she lost her son and a family member who she'll tell us about in a while, just 3 weeks ago to suicide. So I just wrote down here, talk to someone. Talk to who? That is the problem.
Someone you trust, first of
Not
all.
only that, okay. Let's say, look at my case, for instance.
Someone who can help.
And thank you, because I am speaking on behalf of all the others. You already heard Daniel, you heard Andrew Douglas. They were right in studio here. We are all former prisoners, former offenders. We spend time in prison, various amongst combination. Andrew spent the longer. Andrew spent about 40-something years in prison. Now we come back out into society and we want to be part of the solution. Speak to who? Because I could speak to anybody. I could walk across the road and talk to my neighbor. I could call a partner around the corner and talk to him. But who is the one to speak to in the case of me not wanting a fish? I would just need clearance to fish. And everybody just dancing me around until there was a point in time, thank God I don't have any hair on my head, so that I would use the bathroom, I would do everything and not look at myself in the mirror once. Picture that for a moment, people. And I don't think you thought you would have walked into a therapy session here this morning, right? But I thank you for coming. Because think about that for a moment. You do the ablutions, you brush your teeth, wash your face, comb your hair. Picture doing all of that without looking at yourself once in the mirror. That is how Trinidad and Tobago made me feel about myself. That I was worthless and useless. But on the other hand, when I do lectures, most of the times for free, I'm hearing how good I am. So I would look for the people to speak with up to yesterday. Oh no, Friday. I called someone and said, look, are you home? The person living walking distance from me. Are you home? Because this person took me to see someone from government. And I was reaching to the point where, like sliding up down a rope and realizing one hand already off the rope and I'm holding on by one. And, I say, I need to come and tell you this. I need for you to hear this. He said, yeah, when I come back, I'll call you. Never called to this day. That is the kind of pain that people like me experience. And when the pain gets unbearable, that's when we do something stupid. And when you do something stupid, everybody will get on the phone and call Natasha and say, but God could have called me. Or they will call the radio station and leave us some, but God have my number. Mrs. Sinclair has my number. You know that song for me, right, Natasha?
Yes.
Yeah. But Mrs. Sinclair has my number. Why didn't he call me? I did many times. For years. And nothing happened. So, Terry-Ann, I could understand. I hope I don't have to pay for this session, but I'm venting here.
But that is a person that you can actually talk to, a professional.
Yes.
Counselor and or therapist, to help you work through these issues and guide you as to how you might be able to.
But who to talk to when the bailiff round the corner, Natasha? Who to talk to when the bank keep calling? Who to talk to when the bills keep piling up? And you have a skill that can be employed and nobody is employing it. Who to talk to about that? I can't talk to Tamika about that. Tamika can't help me. So this is why I ask the question. Talk to who? Tell me, Terry-Ann.
Okay, so
apart from God.
Apart from God, we have the foundation, the Brandon Gunpat Foundation. You can find us on Facebook. I also have a TikTok account under my name, which is Terry. And we could be able to help you to navigate. I know that there are a lot of people who are unable to afford help with a psychologist, a therapist, a counselor. And I will tell you, if you did not know, each health center in your area has a day designated for mental health issues. I know for Pity Valley, because that's where Brandon used to go, it used to be on a Wednesday. I do not know in your area what day they assign for mental health issues, but listen to me, it's free. And there is a hotline that you can call 24/7. It's 800 COPE, which is 2673. So 800 2673. You can call that hotline free of charge. You can't make the excuse, I have no money on my phone. It is free of charge. You can call that number 24/7. 3 in the morning, you get up and you're feeling horrible and you everything coming down on you. I can't pay my bills the next morning, my mortgage due. I lose my job. It doesn't matter what the issue is. You can call that number and get someone to speak to you who is a professional that can help you.
Right. No. After I speak to that professional, would they call the PS and say, I just spoke to so-and-so? Or would they call a minister? Or would they do that? No, they won't.
No.
Exactly. That's my point. So I just told you all of my business. But then what happens next? I go back to the same hole.
Well, I wouldn't look at it like that, Garth, to
So
be
how-
honest with
how-
you. Sometimes it's better to get stuff out that you've been holding inside for particular men, because men hold a lot in because they were
Telling me.
taught by society that they have to be the strong ones at all times. They
And-
cannot show weakness. They cannot show that something is wrong,
the
especially to
provider.
their
Yes.
especially to their spouse.
My mother
They-
pounded that in my head.
You have to
Pounded.
make sure you are the provider and you are the problem solver. So therefore you should not have any problems, which is wrong. Right? So sometimes even for a man to speak to someone and get some guidance. Now that person is not just there to listen. For example, just this morning, and of course I'm not going to call any names, someone reached out to the page and would have expressed their concerns about their own mental health. That person expressed that they are suicidal, and they gave me all the information of what is happening with them. And you know what was the biggest thing for them? Which is the same thing I used to hear from Brandon. They don't want to be a burden. They don't want to be a burden to their family members.
Thank you, Jesus.
To anybody, their wife, whoever it is. They don't
Yes.
want to be a burden.
Yes.
And therefore they feel in their mind that if they remove themselves from this earth,
Yes.
that nobody have to deal with that. They are a problem.
Yes, Terry, and yes.
But the problem with that is me on the receiving end as a person who dealing with somebody who committed suicide. I have to live, Terry-Ann, have to live with my son and my daughter's father committing suicide for the rest of my life. And you want to hear something funny? My family is long livers. So let me say I live to be 100 years old. For the next 60 years,
Yeah.
I'm going to have to deal with my grief.
What about if we leave a note?
The note is not going to help.
Because I started rehearsing my note.
No,
But I'm not lying. God is my witness. I started rehearsing my notes and I started putting down names and telling people, whoever read this out, I picture Dale reading that note out on radio. And calling the names of the people who could have stopped me from doing what I was planning to do, what I'm planning, or what I did. I already wrote that down, Terry-Ann. I'm not lying.
God, let me tell you something here today, right? There's something called rumination, right? This is just within your thought process. This is not about what's physically happening. Your thought process, with the minute you start to think something negative, do not give it more than 10 seconds in your head. You know what I just do? It could be January, February, March, all the way to December. What makes me happy is hearing a parang. So the minute I start to think about how I went in the room and see my child dead on the ground with froth out of his mouth, I will immediately start to think about some soca parang. Yeah, something. You understand? I will start to think about a parang song and let it play in my mind. And immediately that distracts me from my negative thought. Now, I will tell you, just as you said, the problem's still there, you know. For example, for a man, let's go to my daughter's father. This man got ill in February. And within 2 months, the illness took over, like, like it was crazy. It just went from 0 to 100. And I know he couldn't deal with that. I do not know what was going through his mind, but I also know that he was on a lot of medication, which is what I was saying. There are a lot of medications also that could cause you to have suicidal thoughts. So let's put that aside for now. His problem was financial, health, everything that was surrounding him at the moment. So just as God is saying, you as a man, I can't come to you, Natasha, as my wife, and tell you, hey, I'm not feeling so strong right now, I can't pay the mortgage this month because I don't have enough income coming in and now get laid off from a job, whatever. No, you as a man was taught, I have to make sure I have a solution. But guess what? You don't always have a solution. Right? So the main thing is, first of all, you need to talk to someone. That person could guide you into helping you how to do this thing. For example, I get sick. Let me just say, Alyssa's dad got sick. And he was unable to work to pay his mortgage. Do you know that one of the advice that he could have gotten could have been, hey, let one of your family members go to the bank and explain to them I've been diagnosed with X. And therefore I am not working right now. Is there anything that you could do in the meantime to, prevent my account from getting, and you'll come in and take in the house? Right? That's number one. Similarly, if you have a credit card and you run up your credit card because you stopped working for 3 months and you run up your credit card to 20,000, you can't pay back the bank. The bank calling every 5 minutes. Tech calling every 5 minutes because, in fact, they're going to cut off your electricity this month because you didn't pay for 2 months. How do you deal with something like that? I would say you go to these places and you explain to somebody. I'm not saying that they're going to tell you, yeah, man, you have a free card you could pass because you're sick. I'm not saying that. But there are other options as well. As a man, even for me, myself, because I'm so independent, you think it easy for me to go and tell my mom or my dad or a friend or somebody, a running low this month, I don't have groceries to even make a sandwich for Alyssa. I don't do that, But that's where we just go wrong, and that's part of pride. And for a man, it's part of his ego. And that might come across as being harsh, but it's reality. When you need help, you need to reach out. I know you might be reaching out to Mr. So-so-so and Dr. So-so-so. Guess what? I could tell you from being not somebody who in the high-end bracket of income. If somebody reach out to me for help and they say they don't have no groceries, I will go with my last $100 and buy something and give that person. So the big sawatis and them that you're reaching out to may not be the ones to help you, It might be a neighbor across the road. Boy, Jonas, I ain't had no bread this morning, boy. You could give me a little sandwich.
Jonas.
I just saying.
I know.
You understand
Thank you
what
very
I
much
mean?
for the smile, because it's I'm happy for any reason to smile right now, because I could identify what you're saying. I have friends who I've reached out to, like every time Natasha salary finish before the end of the month, and I looking at, remember you just said, my mother was the one pounded in our heads, pounded in the men in the family head. You have to take care of your wife. You and that's the time she grew up into, right, where the men was working and wife home, and but then it's when she met Natasha, and she was so happy to meet Natasha, and we were, Natasha had a long flowing rasta like Tamika, and I was surprised my mother even liked her because she didn't like rasta hairstyle at all. But she fell in love with Natasha, and I'm saying, thank you, Jesus, at least I made the right decision this time. But to see Natasha in pain, I felt like a burden. So that burden you're talking about, that's what had me thinking that way. Maybe if I just leave this child alone to live her life, and just disappear, then I wouldn't have to live with this burden. But it's difficult, Terry. It's really difficult. As a man, my mother pounded in our head, you must not. And then on top of that now, because of my going into prison, using drugs and all this thing, some of my family have not forgiven me yet.
Yeah.
Natasha will tell you, my brother and I, that boy hate me for a welding plan I took from him and sold while he leave the country already, you know. Yeah, welding plan home. And I using drugs to him to do the welding plans down there, nobody using it. I sell it. That hurt him up to this day. And he remind me that anytime we quarrel. Well, after a while, I realized he wasn't good for my mental health, so I started cutting him off. Right? And just deal when we had to deal business. But this is what I'm talking about. So to know that society rejecting me, my own family have a problem with me still, some of them, and where to turn, boy, that is pain. And I still have to come out and smile and you know, and act normal.
You don't have to, God.
That's pain, Terry, and I pain.
You don't have to act anyhow, you know. You know, there was something this little child told me when she was 5 years old.
That's a daughter, right?
My daughter. When she was 5. I always looking serious. I think people in my job too, I went to a new job, and with my serious look, I think people think that I'm a bit intimidating, right? Because I don't smile much. But it's not because I don't want to smile, but let's say I'm busy or I have something on my mind. I wouldn't have a grin on my face right through, right? But there's something this little child, when she was 5, tell me. She said, Mommy, you know, if you smile, you might make yourself feel better. You know, that's a mindset as well, right?
Yes.
If you, okay, I don't need to put on makeup every day, right? But if I know when I put on makeup, I feel like the best version of me, I will do it. If you know something that make you feel good, God, I tell you, even if you put on some parang, it could be February and Carnival playing, the Carnival is soca.
Natasha will tell you, it's
right?
Calypso.
You find something.
It's Calypso,
right.
But we have but that's the next story.
That's a whole other level.
That's a whole other story. Now we have an organization don't care about Calypsonians.
Yeah.
And just care about themselves.
But
you know,
I think the point that Terry is trying to make is that when you're in that mood, that depressive mood, or you feel frustrated or you feel stuck, there are things in your life that make you happy and that bring you joy, bring you peace. Whether it is for you, it might be ponging tires, flipping tires, right?
No, the exercise,
right.
all right.
Or music, right?
Right, and that is what and then there were times now when I started to over-exercise, because you can't do that, right? Overtrain.
Yes.
And because the sweating and beating of those tires and flipping those tires, people don't know, that was therapy for me.
Yeah.
Because that is something I could control.
Right.
That is something I am in charge of.
Right.
And I could do variety of stuff, and I could get creative and be proud of myself.
Yes.
Exercise is what did it for me. Singing a calypso, learning a calypso. Natasha will tell you, from the time I get a calypso, January, I will keep that in my ear till semi-final. Just listening it over and over and going on stage, and that was my therapy. That is what saved me, I think.
Excellent.
Right? With Natasha, sometimes we would be at the lowest and she will still manage to smile. And in my mind, I saying, what is she smiling about? Why we behind in right?
I mean, the managing to smile is because I'm trying to find ways through, whether it's music, whether it's the cats, and the cats are a big part
and
of
we
it
are
too.
cats do that, play a big part in
Animals
in it,
are
Of
therapy in and of themselves.
Mm-hmm.
So you have to be able to find things that bring you joy.
And I always tell people, and I don't know if you could give young people this advice. Before you make children, if you like cats, get a cat. Get a cat or two. Because a cat, just like children. The only thing is them can't talk. You could only, you have to try to decipher meows, right? But it's the same language. Don't bring that in here. Come down from there.
Yep.
Look, you see, you just break this, and them just throwing nothing and running outside, and they test your patience.
For sure.
Cats, trust me.
We have. So
They test your patience, and all the language they use with children. No, stop it. Keep that outside. Don't bring that in here, please. And whether you say they bring it, sometimes I get up in the morning, a bird shredded in the living room, lizard, you name it, they test your patience. And this is what made me realize that at least I am not misdirecting my anger. because trust me, I could ask Kai to share them every day. So cats, if you want to test your patience with children, folks, get cats
make
first.
excellent therapy
Yes.
animals. Dogs
Trust
too.
me.
I mean, dogs too. But
Animals.
No, but
animals
cats-
on a whole.
Yeah, no, but cats is worse way. If you see them chairs, oh God,
Yeah.
they use
They
chairs
use it
as
as a
scratches.
scratch. Yeah.
Yeah.
All your furniture.
Let's go to a
Cleo,
break.
stop that. Stop doing that. And she will continue to scratch them chairs. And they have different personalities. And then there's our next cat now was Stray,
Oh Lord.
who come by us. Well, he, like, I feel it's a Tida, he the drive what Tida just drop him. You talk about bad. Listen, that cat test my patience to the limit. Until I don't see him, I'm feeling sorry now that, I'm not seeing him these days. Listen, that is my therapy. Tash?
Let's go to a break. When we
Yeah.
come back,
You'll
Terry
hear
will
about the
talk
other
more
family.
about her foundation and
And the other family she lost.
yes, a
Yeah.
little more about that, and we had to touch on perimenopause before we go as well.
Right, so let's go to a break quickly, and we'll be back, and we have some numbers to share for you. Remember, folks, your son at home, I know he probably came home late this morning. Wake him up. I want him to see this 20-year-old giving testimony in court just before he was led away to do life in prison. Life. And his mother. And I want you young people listening this morning to know that when you end up in that situation, when you look behind, your friends don't be in the court with you, It's your mother who have been begging you all the time to stay away from them same friends. She in court with you crying.
Yep.
Stay right there. You'll see it for yourself. We'll be back.
It took me years after to learn. And as I say, every day you can learn something new. You're never too old to learn something. And as I always encourage young men and people and my peers, I am an advocate for therapy because I do it religiously. I believe in therapy. We have this blinders in Trinidad and Tobago that when you hear therapy, you're thinking St. Anne's and Madhouse. It's not that. It's just about perspective. It's just about understanding and figuring out yourself. And a therapist is like buying a shoes. You understand what I'm saying? For me, that's my personal opinion. Not the first therapist you go to see will be the one that's right for you. You can shop for them as well. Like where they shop for sneakers. Someone with a little more knowledge, somebody that you can feel comfortable to relate to and could bounce back and get information from. Once it's the right information and it's coming from a healthy place. And I think all of us as men need to find people. It's like something Selvin said earlier. When we get home, there's nobody that we call because you automatically feel a sense of shame. But you don't feel shame when you're home, though. You ever study that? When you have 3-4 girls, you feel like a star boy,
Hello? Hello, Mr. Dobson here from HMP London. Can I speak to Mr. James, please?
This is Mr. James speaking.
Thank you. Can you hold the line? I have a call coming through to you, sir.
Sure. Hello, Daddy. Hello, yes, Brian?
Daddy, I'm just calling to tell you that I'm locked up in the UK for drug trafficking.
Oh, yeah? You lock up? And you tell me I was going to Tobago? And I tell you about them boy I was liming with? Well, all right. Don't drop the soap. Cheerio.
Eye on Dependency. Reality radio at its best every Sunday on I 95.5 FM. Don't miss it.
You're listening to Eye on Dependency. We don't just share stories, we change lives.
Thank you for staying with us. This is Eye on Dependency, and we are talking mental health. We're trying to, lighten the mood a little bit because these are the things that help to distract our brains from the really serious adulting life challenges that we all face. Garth, you wanted to...
Yeah, you lost another family just 3 weeks ago. How did that happen? And was he in the same situation as your son, Brandon? Or?
And also, did that help to connect in your brain the connection between someone's physical health and the emotional stress that brings and what that does to your mental well-being?
Definitely. I think that people, especially people who have a serious illness or they have been diagnosed with something serious, and this is not mental, this is just physical. Let's say somebody gets cancer or something like that, and they are told at the moment by the doctor, listen, this is what you have and it's terminal. That in itself will cause someone to get mental health issues. You get depression, you get anxiety. There's a number of things will go on with somebody in their brain if this is what you're hearing. Even if you are diagnosed with a disease, a communicable disease that is going to last you for the rest of your life, that you have to take medication or you have to inject yourself with insulin for the rest of your life, that in itself will have an impact on how you feel, how you think. It's going to depress some people, right? Let's be real. If somebody come and tell me, well, you know what, we're seeing that you have hypertension because your dad have hypertension, over a consistent basis when we check your pressure it's high, so you have to go on medication for this for the rest of your life. That in itself will make me feel some type of way. And honestly, that is what I think happened with Alyssa's dad. I cannot be sure because he did not speak to us and say anything, but just as I was telling Garth, men are trained in a way where they are not supposed to be coming across as the one that have any problem.
Not to be show any vulnerability.
No, they must not show weakness at all. And to a man who grew up with those types of standards, they are going to think that even if they complain about something, it's going to be them showing weakness to anybody that they are around.
But Terry, I spoke to men, and you will tell us men, okay, even if a woman don't understand, and I'm talking, when I say men or women, I am talking about a permanent secretary or a minister or that kind of thing, right? But you tell yourself, when you speak to a man, he would quicker understand emasculation. He would quicker, I have said some things to some men in this country of ours here that they're not supposed to know, but I decided, let me bear more then. Let me say more, right? Natasha did the same thing. When the morning when she woke up and saw me on the ground bawling, she sent a voice note to her minister, and he never responded to her. Listen to it, yes, but never. And she, I mean, imagine a wife reaching out to you and saying, hey, my husband in a mess right now, my husband in short of last, my husband going through this, that, and the next, and you ain't show no concern for that. So how you think that made me feel? Even worse.
Yeah, you feel alone.
Yes.
And you also feel
that is it, alone.
also feel that you've exposed yourself.
Thank you very much.
You've allowed people to see what's happening with you. So now you start to feel like, wait now, so nobody ain't taking me on.
Yeah.
And now everybody know my business.
Right.
Because I went and I tell who so my business, and you don't know who they share that with.
Thank you.
So now you start to take it on where you're feeling like you're on the spot now. And
Yes.
every time somebody see you is because they're thinking, hey, he have this problem, I had to stay away from, and that is one of the main points I have today.
Thank you.
You see the stigmatization, the victimization, the ostracizing of people when they have problems. I will tell you this, and I don't want to sound condescending or like I'm trying to say that it's going to happen to somebody. But every person on this planet, whether they're rich or they're poor, does go through some type of issues at some point in their life.
It's life.
It is life. It could be the death of somebody and you taking on that, and that's grief, right? It could be you lose your job. Let me say you poor and, okay, God, you as a man, you are the only person working in your household and you lose your job and now you have 5 children and you have your wife to take care of. It could be what circumstance somebody is facing. Bet your bottom dollar at some point somebody going to face something. Your wife leave, your husband leave. They horn you. Something could happen.
And this is why
somebody
I said,
will go through something, right? But
yeah.
what we do wrong in this country, I don't want to talk about the world, I'm talking about here.
Yeah.
If I find out you have a mental issue, or I find out God lose his job, in the moment I find out, I feel sorry, right? I will send you a little message and I will say, listen, anytime you need me, call me. But guess what? I don't want to be associated with that because it's too negative. And I don't want to be associated with that because that bringing me down. You see, that mindset is totally wrong. And there are very few people out here who actually have empathy for others.
Yes.
In the moment when the iron hot, you're striking, you know. You know why? Because it's so publicized. When Alyssa's dad died 3 weeks ago, it was on Ian Allen. So
Really?
every Tom, Dick, and Harry call or message. And they say, oh my God, is this Alyssa's father? So. And I had to say, well, yes.
Wait a minute, how he died? How did he commit
committed
suicide?
suicide.
Right, how, I mean, sorry, yeah.
Honestly, I don't like to say how somebody do it because it are
Right.
people who will be listening
Yes.
who are inclined and they will
Right.
think that that's an idea for them.
So he was found somewhere?
He was found in his house.
In his house,
Yeah,
okay.
right? So in that moment, everybody reach out. But I'll tell you, after the funeral, hardly anybody
Silence.
trying. And that is what happens. When the iron hot, everybody's striking. And then everybody gets on. I'm not saying that people not busy. All of us have, we all have our own lives, right? But that does not mean that you can't be your brother's keeper. I will tell you that from my perspective. Because you never know what someone is going through.
So what was he going through? Did you know? Because
He got ill,
Uh-huh.
and within 2 months, his illness got progressively worse to the point where he had to depend on others.
Oh.
And he's a real macho man. Everybody who know this man, know
Independent.
he don't like to ask for help. He don't want to be a burden to anybody, and that's how he used to behave. So I believe that is what eventually triggered that. Also, as I said, he was on a lot of medication that may have altered his mental ability.
Okay.
Right?
So what you're trying to tell me here is that I am strong then?
Listen.
Yes.
This what you're trying to say to me, right?
Here's what I want to tell you. You don't have to wait for somebody to come and help you, you know. While that might sound kind of, off, you have to build yourself from the inside and tell yourself, listen, this person, this minister that Natasha sent a message to, are they coming and bringing a plate of food for you when you have no money?
Just let him talk to me.
Good. So I just have to tell myself this every morning. Don't feel I don't get up with anxiety every single morning, more so now that Alyssa's dad died.
Anxiety.
But I have to get up every morning and know that I have to do this. So what I will tell myself, I will go and while I bathing, that's my personal time, I will talk to myself. You have to do this today, Terian. You're feeling sad, you're feeling down, you're feeling anxious. You have to do this today. Get up and get it. Right? God, I could understand, I could understand that everybody have issues going on, We all do. But you are the person have to encourage your own self. Talk to yourself. You try to get help for yourself. If you cannot afford to go to a private doctor or counselor, you have clinics available. And I want people to understand that.
See, this program, Independency, is what did it for me. While I was waiting, because like as I said to one minister in the past government, I'm not asking for a fish, I can fish. I just need to be cleared to fish. And you can do it for me. And it's promise and promise and promise and promise and promise, and nothing never happened. The military already turned their backs on us. The guys in the era where I was using crack cocaine, when they solely introduced crack cocaine to the force, and there are a number of sailors and soldiers who were discharged. So, and the military weren't supposed to do it. The Defense Act spoke to treatment and not discharge. We didn't know that. So they kicked us out on the street, and we had to fend. So from there, it started for me, right? Well, I'm from a dysfunctional home to the military, and I had to go back to the same dysfunctional home. But we were left on our own. Thank God I had enough military training that I survived the streets, I survived prison, and I came out. And I came out with scars. Now, I decided I'm not going to be a selfish person. I'm going to use my experience now to help and prevent other soldiers and servicemen. And you see what you just said here? About losing your career or losing your job and you have to embark. This is why I say it every Sunday to servicemen. Cherish the career that you have, because the moment you lose it, you are an extra mouth to feed home. And sooner or later, you're going to become a burden on your family. But you have a record now of being dishonorably discharged. It's going to follow you. So be careful with your career, hold on to it, and do not mess it up. Otherwise, you're going to regret it and have to tell the story I tell in here this morning. So, Terian, I understand but it's a lonely road. And I am hoping that one day, it may not happen in my lifetime, but I'm speaking on behalf of all the others who will be leaving prison tomorrow or left prison already and want to be part of the solution. I am calling on the authorities, whoever it is, whether it's this government, the next one to come, or whatever, make a space for us. Make a space. We have remorse. We're sorry for what we did. And before it's too late, it may be too late for me, but there are others coming out. We have young Daniel who's pleading for his career to be cleaned. And I see now the Ministry of Justice have made some inroads into that, and I'm hoping that they would continue so young Daniel could get his career and get a clean police certificate of good character, and others like him. Maybe I'm the voice for them. And maybe I might die with nothing. I never applied for a food card. I never asked for public assistance. I never asked for nothing. I never got any favors from the last government. Never. I spent the rest of my life, all of my life, begging and pleading to be part of the army to fight this war. And instead of that, I got the opposite. Terian, is not easy. And I thank you for this morning, for being here. And I still feel that my job has to continue with the support of Natasha, but how much I could ask Natasha to take. You know what I mean? For people to recognize what we've done for Trinidad and Tobago. We've produced tangibles for this country that in any other country, we'd have been on CNN almost every night. I'm serious. I'm not making this up. They have drug treatment courts in this country because of us. And I want you all, if I pass away tomorrow, the history be written properly. Drug treatment courts in Trinidad and Tobago because of Agatha and Natasha. These two simple people here. We did the research in the UK, US, and Canada, and we were thankful that the judiciary accepted it, the proposal, and they have drug treatment courts here now. We have a film that helped this country reach the tier 2 on the trafficking in persons watch list. We, two citizens here, did that. And we have a radio station in the prison right now. We, two citizens, did that. Let the history show that. That's all I can leave with right now. But before we do, I want Natasha, and we have some numbers to share with you for places you could call. Yeah, Terian shared some just now. Let's go to this. Could we go to that now, Natasha, before you run, because you see time, where the time is. Ladies and gentlemen, I want you to look at this young man this morning. Get your son to sit with you. Just 2 minutes, 3 minutes, 5 minutes for the most. These videos are. And I want you to hear from the young man first. He's 20 years and he's on his way to prison for the rest of his life. And we talking about mental health. You could imagine the state of his mother when she leave that courthouse. That's the last time she saw her son, Terian, because he was encouraged by others to go and commit a crime. Let's look at it.
That's video, short man. You could play them back to back. We're gonna hear from the offender himself first, then from his mother, and finally from a former warden who is basically describing the prison industrial complex and how his labor as a 20-year-old young man is part of the broader plan or scheme to incarcerate young men to serve the state, modern day slavery.
But I'm a firm believer that God can use anything for good that the devil wants it for bad. And so I am grateful for the people I've met, for the lessons that I've learned, for just this experience in general, because it's one that I'll never forget, and it's going to shape the rest of my life.
Sounds like there's that saying, it's kind of cheesy, but you make lemons out of lemonade or whatever. Your name for our court reporter?
Damali Lyle, D-A-M-A-L-I-E, L-Y-L-E.
Lyle, how are you related to Sean Gathright?
Sean is my son.
So we've heard a lot about Sean as a child. What do you want the jury to know about your son?
I'd like the jury to know that my son is a hardworking person, a hardworking young man. He's intelligent, he's driven, he has a wonderful work ethic. I want the jury to know that this is not, I believe what has been presented is not my son.
Yeah, I'm going to sustain the objection. Listen, I tell you what, I need the jury to step out momentarily, okay?
All rise.
Okay. Okay, so Ms. Lyle, I just want to first acknowledge that I recognize this is very stressful for you and scary. I do. But the jury has determined your son's guilt. That issue's been settled. But we're not going to revisit that in front of the jury. So I just want to encourage you with regards to your penalty phase testimony, the best thing you could do for your son is just express all of the wonderful characteristics about him, okay? And how deeply you love him and how deeply he's loved by his family. This is not the time to be readdressing any of the facts of this case. All right, I just want to make sure that's clear because I want to allow Ms. Finkelstein the chance to ask you the questions she wants to ask you and for you to relay this important information to the jury. But if we start going sideways into issues that are not pertinent to this phase of the trial, then the state's going to have to object, I'm going to have to rule, and then it just really, it lessens the impact, really.
I just have one question. If I say, well, what I was going to say is, this is not the son that I know, is that
that's
a part
fine.
of the...
That's fine. I think, and I think because you did testify previously in the co-defendant's case, I think just based upon that, I suspect the state's a little concerned that we're going to start heading down. And so just as long as we all understand what we're doing here, then it should be fine, okay?
Based on Mr. Gathwright's age, physical abilities, things like that, do you think that the prison would benefit from him in a work capacity if he were sentenced to life without parole?
I say yes. With my experience, not only just in classification, but as former warden and even as a jail administrator, he's someone that's young, he's healthy. In reality, we need that labor, we need that sweat equity, and we will put him out there to work because we do have an aging prison population, jail administration. We have that, so we put these young individuals to work and get some sweat equity out of them since they are young and actually can do the work.
And I know we talk about life without parole and death row, but for our jurors' education, in Florida, what does a life sentence without parole mean?
A life sentence in the Florida Department of Corrections means from the minute they're brought in, they're assigned an inmate number. He will be assigned an inmate number, and when he dies and leaves in a body bag, he will still have that inmate number. An inmate serving life will never, ever get out. There is no parole in the state of Florida, and they're not ever allowed outside the razor wire and the fence of a secured facility.
So the only way that an inmate serving life without parole would leave is when they die by natural causes.
Yeah, but you know, I mean, and the thing is, his parents didn't encourage him in crime. He grew up in that sheltered, but I'm not say shelter, but that home we call a good home. Yeah. You know, everything was provided for him, and
everything provided for him. Yes.
Yeah, and he's on his way
despite that,
to prison for the rest of his life. For his life, that is it. It's done, unless they feel sorry for him when he's about 80 and decide to send him home. You know, but that's it. His life is over, and young people, I want you all to understand. When we look at you all fighting people, when you like to kick people, because there's a new style now, kicking people in the head when they're on the ground. The moment you kick somebody in the head and they die, that's it for your life, you know. So all this anger being displayed, especially what happened with the older man, and they actually kicked this man in his head. And you know, and there's this sampat thing where 4 or 5 men just bomb rushing somebody and just beating them into the inch of their life and kicking them in the head like this kicking penalty. The day you hear your son kick somebody in the head or daughter do it, and that's it, you know, that's it for them, and that's it for the rest of their life. You know. So let's go ahead. We just thought we would have shared this with you all this morning.
And a couple of points I wanted to bring up about the mother who, for all intents and purposes, thought her son was a good boy, right?
Mm-hmm. Yeah.
Because that's how she raised him.
Right.
However, even in that moment of going before the court and trying to lessen his sentence or appealing for mercy from the jury, she was still trying to litigate the case and say, this is not my son, but it is. It's not the son you knew.
Yeah.
Not the son you raised. This is a man who has committed a horrific offense.
And
is
that's what
going
always
down.
describe them as a good boy. My son was a good son.
But
you know?
yes, well, as far as she concerned, yes, he was.
Yeah.
But unfortunately, even though you provide your child with everything that they need to grow into a fully functional adult, sometimes they slip through the cracks,
And the more prestigious the school, is the prettier the designer drugs will be. Trust me. You see the schools that we consider to be for the what you call it?
Hoi polloi?
Yeah, but the other side of the fence,
The 1%?
Yeah, okay, fine.
Other side of
But
the
the
fence.
prestigious schools,
Yes.
you see these youngsters get credit cards too, as gifts. So some of them youngsters going to school have their own credit card,
Yes.
and they could go online and order drugs and bring it straight to their door.
I remember when I was in school in the 80s and 90s and reached the Form 6 and somebody in our class
had a credit card.
had a car. And we were like, no.
Yeah.
Car at 17?
Yeah.
All right.
And they could get drugs delivered home to them.
Correct.
All right. And the ones who go in on the East-West corridor, they get in the step-down drugs. The one that they step on many times, so they get in the what, how books you describe it, the bodonkadonk. The drugs that worthless but do the same damage.
Yep.
So don't think.
So it's
don't
either
think
either they didn't think they would get caught or they didn't think that they would be put behind bars.
Yeah.
Or face the electric chair. Because as we know, at 20, your brain is not fully developed. These are children still, who have no idea what the real consequences of their actions are. I don't know how you will fare in
But
prison,
they want to impress each other, so when they get in a fight with somebody and they gang up on somebody, everybody must get in a kick.
Yeah.
Or a piece of wood and kicking children in the head.
Yep.
And all this. Well, carry on, go ahead, but just remember, just like this handsome young man here, you will go to jail.
Not too handsome for jail.
You're not too handsome for jail.
The last point I want to raise is about what the warden said. And remember, this is part of a larger issue because he said the prison population is aging, right?
Mm-hmm.
So what do you think will be behind all of these young men ending up in prison? They want to fill the jails with young people so that they will have so they can get sweat equity from them.
Yeah.
This is the plan.
Mm-hmm.
Which is why don't be surprised when you hear about more police, more jail, more laws on the books. Because they're trying to fill the jails with young men. And in America's case, young black men.
No, I wouldn't say they're trying to.
Well, you're correct.
Yeah, but I wouldn't say they're trying to. Is if we give them the opportunity to fill the jails. And that is where we have to do prevention.
Well, that
to
is
stop them from filling the jails.
That's it.
So they could build 10 more jails. They could hire a million prison officers around the world. It is up to the individuals to not go in there.
Yes, but how much?
Right?
How much
Nobody's
is spending
making the jail for you to come in.
No, I agree. But how much is the state spending on this prevention? How are they supporting programs like Iron Dependency that are trying to do the prevention?
No, well, they're paying people at got off your mouth. You see you always getting in trouble.
Okay, good. Before we take some calls, I just want Terry to talk a little bit about the foundation
yes.
and the work that y'all do in terms of providing the support and also, dispelling the stigma.
And then before we go, maybe Natasha could share these numbers of mental health resources,
yes,
urgent care and mental health facilities in Barataria, Pembroke Street, Child Guidance and Pembroke Street as well, Indigo Martin,
yes,
Sangre Grande, Toco Health Center, Rio Claro, Mayaro, and Point 14. We have places there that Natasha will share these numbers for, including San Fernando General Hospital, Eric Williams Medical Sciences Complex, Scarborough General, St. Anne's Hospital. Kerry?
Kamika.
Yes, so tell us
Yes.
about your foundation and how people can...
All right, so it's the Brandon Gunpat Foundation, and you can find us on Facebook. You can message us at any time, and we will try to assist. What we do is to provide support. I'm talking about support that I needed when my son was diagnosed with schizophrenia. I didn't know who to talk to. I didn't know who to discuss drugs and the side effects, all those things. And I also did not know if I could trust anybody with the information because I don't want it to be used against us. I can tell you that we are confidential. We will be able to try to help you if you need guidance to get to a counselor, therapist, psychiatrist, places of that will be free, like the health centers. I could guide you to the stress relief clinic, which I've guided a lot of people and they got help, and this is without medication. I can help you figure out, like, if you are experiencing side effects, like what you should do, if you should go back to another doctor, if you should check another health center, that kind of thing. We provide support. And if you just need someone to listen or to give your experience because you feel overwhelmed, we are available. You can message us on the page, and if need be, you can send your number. I will call you because I've done that numerous times.
And I did share the link to the Facebook page on the Facebook Live and on YouTube as well. So you can please check out the foundation on Facebook.
And good morning to those of you on YouTube and Facebook. Thank you very much for joining us.
Yes,
YouTube
yes.
family is showing up this morning. Thank you very, very much. Rosemary, June, and remember to tell us where you're looking at us from, whether it's outside of Trinidad and Tobago, especially Runstout. That's first time I'm seeing that name. Stanley, welcome to Rosemary, as usual, leading the bunch here. But thank you very much. And remember, while you're on YouTube, please remember to like and subscribe to the channel. Also on Facebook, please do the same thing. Let's try and get to 10,000 flat on Facebook, and while improving that YouTube subscription as well. Please remember to do that. So we take some call at 622-3937 before we wrap up. I had a chance to vent this morning, and I thank Terry for coming in here. I'm sure you didn't expect to walk into a therapy session, but the Lord knows the pain behind my smile, when I managed to do that. There are those who actually celebrating my tears. There are those who are, right? Yeah. For some reason, whether it's for political reasons, I don't know. I'm not a politician. I'm not an activist, but it's all I can ask for is for the Heavenly Father to speak for me. I want Him to speak for me now, because I have spoken so much, and I keep waking up every morning and say, Lord, fight for me. Wherever you are, fight for me, because the same God who lifted Joseph out from prison, the same God who restored Job, I hope He's paying attention to me, so that He could help restore me too, and at least let me die with a smile on my face. At least that I would have accomplished. Let my life become proof that people like me can be restored and be respected. That's all I could ask for now. 622-3937. Hello. Welcome to 622. Remember, the lines are open. You can call us if you have anything to share, any questions to ask Terry.
While we're waiting on the phone calls, can we just play this one video that talks about what depression looks like? I think it's an interesting take on depression in particular.
Okay.
So that's video J. It's just a minute and a half.
Shortman, go ahead and play that, and we come back and take some calls.
Believe it or not, this is what my depression looks like. It looks like this. Paradise, you might think, and you might see images and beaches online, but I haven't been on the internet for a while, because to be honest with you, my depression turns up even in paradise. And I don't use the word lightly. I have been medicated in the past, I've been hospitalized before, and I just wanted to share with you, because sometimes you see things online and you think that it's absolutely perfect, and you have no idea what is going on behind those images. Also, for me, I definitely pull away from people. I don't communicate. I turn off my phone. I don't access the Wi-Fi, even when I possibly could, because I just sit with it. You know, fortunately or unfortunately, I have 2 children that I have to show up for every single day because baby, I'm by myself and there's no choice. But at the same time, I battle these negative voices in my head. And to be honest with you, I'm not sure that it will ever truly go away, because if you can feel like SHIT in this environment, then I'm not sure where is going to be your state of peace. And you know, I know that I have so much to be grateful for. I mean, look where we are. But at the same time, that doesn't quieten the negative voices in my head. And the reason I share this with you is, one, be careful of what you're consuming online. Be careful of the presumptions you're making. Also, checking on your friends, even the strong, smiley ones, because trust me when I tell you, you would never know if you meet me, right? I need an Oscar award for the acting that I'm able to do. But ultimately, life is what it is, and we try and take one day at a time. My darling, you're welcome.
Yes, so that is what depression can look like. And as April said, you know, beware of the content that you consume, especially online. It's very easy for us to go down rabbit holes and doom scroll and look at other people and what other people are presenting themselves as, and think that, you know, you're not achieving as much as you should be, or you're not in a place that you would like to be. Don't compare yourself to people you see, especially those online.
622-3937.
Yep.
622-3937. You can give us a call. Hello.
Hello, guys.
Hi.
That's my melody radio.
622-3937. Good. Hello.
Good morning to the St. Clair's,
Morning.
the producer, and the lady, Miss Gunpat.
Yes.
Good morning.
Miss Gunpat, Jill, God bless you. I like how you came out here and you explained your situation. What we have to do is, whenever people come with us with issues, we must listen, give advice, or try and seek help for them, right? So I'm glad you came today and you experienced something to behind every dark cloud, there's silver lining. And I'm glad you came because you gave God some options to cope.
Yep.
So good. So once more, we have to be our brothers and sisters and people. One love.
Thank you.
One love,
Thank
brother.
you.
Hello.
Hi, good morning.
Hello?
Morning.
Yes, morning. You're live.
Hello?
Yes,
We are
ma'am,
hearing
you're
you.
live.
I'm not hearing you all, but I will speak. I just called to tell you to have faith in God. Nothing is too difficult that He cannot do for us. I have a daughter, right? She's going through depression. The tape that you all play this now there is the same thing that happened to her. She hearing voices in her head, right? Voices, right? She has 3 children. One is autistic, right? She has, you know, she lost in sleep and things. She had to be up with him and things, right? And she called. She went to an institution. I will say Mount Hope, and they called her, and she was talking to them on the phone, and she was telling the person that she hearing voices, what is this and what is that and thing. And they say, well, I don't know what really going on and thing. So you see what happened. People going through depression in all angles. It is the husband plus the children and things. They send ambulance for her, right? She says she's not going because she's not mad, right? But we continue to stand by her, praying for her, and God is seeing she through by the grace of God. So God, don't give up. Natasha, hold your husband, and all pray together. The family that pray together will stay together. That's
Thank you,
my
sister.
words of God.
Thank you very much. Thank you. Thank you so much. 622-3937. Hello.
Hi, good morning. We're hardly hearing you, sir.
Hello.
Please
I don't
try
know what
again.
happened. Please try again. Hello. Good morning.
Good morning, God, Natasha.
Hello.
This program is so timely that God, right now, I have a friend who keeps telling me to go to the hospital and speak to them and see if I could get medication for depression, right? But my concern is the medication what they could give me, I am afraid that I could get hooked on that medication. You understand? So I not going for no medication, but I talking, you see like how I know to talk, like call the radio program. I just talk what going on with me and thing, right? To help me deal with it. Because you remember the last time when I attempted suicide, you remember that, right?
Yes.
Yeah, and I just said to myself, if it had something I could have take that I wouldn't have to go through pain and all them things, so I will have take it. You understand? But I say I'm not going through that again, So I just talking and as much as I could about what it is going on and things, because I'm going through some situation right now with divorce settlement and property and all them things now. So
yes,
and the person doing me something that could get me in trouble now. You understand? So right now I just trying my best, stay away and just keep working. As you work, it come like I have a working addiction now. Sometimes I find myself drinking and getting blackout and all of that too. So. It ain't easy, but what is important for us, at least I know, don't keep it in, because pressure is burst pipes. So I learned now to talk. I just talk to everybody. People say, well, you shouldn't be talking to everybody about what's going on with you, but I just talk, because if I don't talk, my pipe go burst.
Yeah.
Yeah, but this program, this real time, and for the lady who you always doing talking to this morning, or I don't know if it's a tape or if all you was talking to her.
She's still here.
Oh, she's here. Oh,
yeah.
Well, Miss, good morning. And from our experience, all I could tell you is, it's about God, and He know and see everything, and He allow us to go through certain things, because ask God, after my attemption of suicide, when the doctors and him give me 2 weeks to live and tell me they want me to stay in the hospital, I leave, I discharge myself, and look, I still alive till they say all my organs was going and thing, because remember it's Clamaxone and punching I drink, and them give up on me, and look at God have me alive today, and this program. All right, I'll go on.
All right, don't worry, we'll keep in touch with you. I'll call you, right?
Keep holding on.
Yes, brother, keep holding on. Before we take that call, from Faizabad is in the house. Glencoe, Camille from Glencoe, Russ Mongrove from Faizabad, welcome. Also from Twin City, Scorpion Pepper, welcome. Dexter from Ridgewood, New Jersey, blessings. Hi, Dexter and wifey. Good morning to you all. From Diego Martin, welcome from Diego Martin. Those
and
of you.
Of course, the regulars on Facebook, Pearl and Eudine, Edith, Rosario, Kathy, and Lorna. Annette.
Yes.
Yvonne.
Good morning to all of you.
Alison,
thank you so much for your
Yola.
continued support. You all don't know how much what you do for us. You all don't know, but keep doing it, right? And remember, look for our account number, and if you can, please make a donation to our independency. Hello, good morning. Hello.
Hi, morning.
Yes, good morning.
Morning.
That,
yes, sir.
The last time I saw you was upstairs, IMAX, right?
Mm-hmm. Yes.
When you had the show up there now.
Mm-hmm.
And let me commend you for all your work that you continue to do, right? The gentleman who called, you know him personally?
Yes, I'm familiar with him, yes.
Okay. So, if he's listening, so I could not say that I could imagine where you are at all. But one of the first things I want to say to you is that we all as individuals, there's something common in us, the God-given genius in us, right? Individual genius. And I want to say to you that when we love ourselves, we don't do bad things to ourselves. So I'd like you to just maybe go to the mirror and have that conversation with you as to whether or not you love yourself. And if you love yourself, then chances are you would not do bad things to yourself. And do not beat up on yourself about whatever you did in the past, because life is about now and today. If you embrace that your life is about now, in this moment, in your present moment mindedness, right? Then this is what matters. Every 5 minutes in front of you, you try to make sure that that is a moment that is spent loving yourself, and that will affect the next 5 minutes to come. As a grown individual, you have to understand this. You cannot unhappen what has already happened. So whatever you did to yourself in the past, that is behind you. And it is the beautiful thing about the life that the man above has given us. He's given us a fresh new opportunity every 5 minutes of our life. So you cannot beat up yourself about what you did in the past, because that is behind you. You cannot fix that. You cannot unhappen that. But you can change what goes on in your life going forward and have a wonderful life like I'm having. In addition, when it comes to property, I heard you say going through a divorce and about property and all these kinds of things. We on an individual level determine what is priority in our mind. But the greatest property you have, and if you really want to figure out how to control an asset and how to manage an asset, then you are the greatest property owner of you. There is no other property that is as important as the property that you possess, which is your property. And God, I would love to call you after the show is finished. I'll reach out to you. I want to meet that guy. Thank you.
Okay. All right, no problem. Well, that's a nice way to end. And I think we'll have Harold in here. I mean, we had some other plan, but I think Harold's situation is urgent, and we need to hear from him. All right, Tanika? Okay, you write it down for me now. All right, so folks, this is where we have to leave it. Any closing remarks from Terry-Ann? You open some doors here this morning. I want to say to Randy, I won't say his last name until he give me the clearance to do it, but thank you very much for allowing us to be back here next Sunday, God's willing. And to the Friends of Our Independency donated so that for that to happen. And we thank you very, very much. Terry-Ann?
I would just like to say to anyone that needs, like you need somebody to talk to. Sometimes people just need someone to speak to. You can reach out to us at the Brandon Gunpat Foundation on Facebook, and you can send me your number. I will call you.
Okay. Oh, that's Sean. Right, I have his number. Yes. Gosh?
Yeah. Thank you very much. Thank you for the impromptu therapy session for Mr. Gas. Clearly you needed it.
Yeah, I needed it. Thank you very much.
But we definitely are open to anything in the future that will help to advance the cause of the foundation and mental health awareness.
And the two people sitting silently in the studio here with you,
Yes.
my brother in the back here, thank you for supporting Terry-Ann and your daughter, who's here very quiet. And thanks a lot for being here to support Mom. Folks, you all out there, if you need help, don't take the easy way out. Fight it. You know, sometimes when we feel that the tunnel is not going to end, it's just about 2 more inches to dig and you'll be through. Yeah? So I'm going to keep digging. Tamika, thank you very much once again for being here. Folks, you all take care. Talk to your children. You talk to them every day. They could call you miserable or not, because I wish I had my mother here to tell her how miserable she was, but she was right on most of the things she said. Talk to your children, please. All right? Take care. God bless you all. Have a great week.
Good afternoon.